It has taken less than 2 weeks, but already the new Omicron variant showing signs it will likely dominate Delta. As we told you in our first half hour, the numbers of cases in hospitals in the tri-state are up. And infectious disease specialists say this is some of what's behind the surge in local hospitals as these two variants begin to overlap. According to the CDC, the Omicron variant, it appears to spread faster than Delta, be resistant to certain treatments, and at least partially escape both infection and vaccine-induced immunity.
What is happening is that data are emerging that there is a diminution in protection by the antibodies induced by the standard 2-dose vaccine.
Well, boosters are now recommended for all adults to make up for that drop in protection and try to keep people out of the hospital. Infectious disease specialist Dr. Stephen Blatt told me today we may need to change the interval for when they are given as Omicron takes over. Already, countries such as Denmark are recommending them at about 4.5 months instead of 6.
And the reason is that it looks like it takes a higher antibody level to inactivate Omicron than it did the Delta virus.
Dr. Blatt says his hospital COVID-19 cases here at Ohio's Good Samaritan Hospital are mirroring what the CDC reports in the rest of the country. Caseloads are mainly due to Delta, but they are already back to where they were in the early stages of vaccination almost a year ago.
During the peak of the kind of big wave last winter in January and February, we would have around 200 patients in our hospitals. And then when Delta came, our peak in September was 120, and that's exactly what we've got in the hospital now.
The concern is that with cases of Omicron going from one reported case in the U.S. December 1st to at least half of all states reporting cases now, just because it's so transmissible,
it will result in just sheer numbers of patients entering into hospitals.
The other concern is that certain therapies that work on the variants so far, such as monoclonal antibodies, don't appear to work with Omicron.
Some of the early studies suggest maybe not quite as well, at least for some of the products.
Yet another concern then, those not vaccinated or who have underlying health conditions who get Omicron will add to the already rising hospital cases. And Dr. Stephen Blatt, who you heard from there, says he does expect these two will collide in the weeks that likely follow the Christmas holiday. That'll make a tough start to the new year. But he also says that means now is a really good time to get a booster or an initial vaccine to protect you.